Robbie.
Now, the Kenya Pharmaceutical Association Western Region chapter is meeting this morning with a focus on quality pharmaceutical care and the role of pharmaceutical technologists in healthcare delivery. The Kenya Pharmaceutical Association is an association that brings together over 10,000 pharmaceutical technologists with an aim of ensuring good pharmaceutical care as well as protect the public against professional misconduct or abuse of privileges by pharmaceutical practitioners. They will be educating members of the public in Western Region on how to identify fake or counterfeit medicine due to the entry of counterfeit medicine or drugs through the Uganda-Kenyan border and the way to handle residue medicine after completion of doses. Our Willie Lusige is there. He now joins us live from Kakamega with an update. Willie, good morning. This definitely, as I've just mentioned, comes in at a time when there's a lot of counterfeit goods coming into the country. How is the public likely to benefit from this meeting?
Good morning, Akisa. Before I talk about the reception by the members of the public, the World Health Organization has continued to warn that Africa is turning to be one of the biggest markets for the counterfeit and also fake drugs. Actually, by their statistics, they have indicated that more than 100,000 annual deaths are linked to these counterfeit drugs, and that is what the Kenya National Pharmaceutical Association is trying to fight, especially that you have already noted that in the country, one of the entry points for these fake drugs has been Mombasa for a long period of time, but now we have seen other new entries such as the porous Uganda-Kenyan border where these fake drugs are getting their entry into the country, and part of that affecting mostly Western Region because it's aligned along the Kenya-Uganda border. So the Kenya National Pharmaceutical Association is trying to educate members of public on how to identify these counterfeit or fake drugs, and apart from that also move around Western Region to see if the pharmacies that are within this region are trying to implement all the regulations that have been put in place. And what I want to do, because they have been here for a whole week, they're having their final day tomorrow, well, they'll be meeting now these pharmacies, but today and the previous days they have been talking to the members of public in different sub-counties. I'll speak to the chairman, the national chairman for Kenya Association of Pharmaceuticals. Maybe welcome to KTN News. We'll start with your name. First of all, we have new regulations put in place to manage pharmacies in the country. Maybe you can tell us briefly what it entails. How has been the receivership by the members of public and also these pharmacies and also your association in general?
Thank you. My name is Patrick Adera. I'm the national chairman, Kenya Pharmaceutical Association. Yeah, it is true that this year we have new guidelines from the Pharmacy and Poisons Board. These guidelines are to regulate the practice of pharmacy. Currently we have 3 new guidelines. One is to regulate the distribution. That is good distribution practice guidelines. We also have guidelines for pharmaceutical waste management, and we have guidelines on transportation of pharmaceuticals. The public hasn't much interacted with the guidelines. For the professionals, we've interacted with them as an association. We've looked at the guidelines. The initial feeling was that the guidelines were to give us a solution. Unfortunately, that may not be the case because the good distribution guidelines has provided for some capping on who is to be licensed to practice. And that has locked out a lot of so many potential professionals, and that has made so many outlets. The existing outlets are not to be licensed by now because initially after enrollment you are to get the license to practice. Currently what the regulator has done, the guidelines now provide for 6 years post-enrollment without taking into consideration that these businesses have been in existence, and therefore failing to license them allows so many unregulated outlets to exist. And to me, when you deny the professionals room to practice, ideally what you are doing is you are encouraging quacks, people who are not licensed and people who are not qualified to do the pharmacy business. And therefore, my challenge is to the Director of Medical Services, Dr. Kioko, and the CS Health, that is Madam Cecil Karaoke, to, as a matter of urgency, intervene and make sure that all pending premises and licenses for 2019 are released as soon as possible, because as an association our sole mandate is one, to bring the pharmaceutical technologies together, and also to protect the public against any professional misconduct. And that can only be done if at all the channels through which drugs are supplied to the patients are secured. And to secure the supply chain, then we need to make sure that it is the professionals that are in charge of the supply chain.
You have talked about professional misconduct. We have had so many cases recently as an association. What are you doing maybe in regard to that?
In regard to professional misconduct, within the association we have ethics and disciplinary committee, which is mandated in just dealing with professional issues. But the beauty is that even at the Pharmacy and Poisons Board, they've introduced inquiry and disciplinary committee. This is an ad hoc committee that will deal with all professional misconducts, ranging from people handling substandard drugs, counterfeits, people in private pharmacies handling government drugs. We know that there are so many government drugs that are ending up in private pharmacies, which is against the law. So there are committees.
And maybe as we wind up, we have seen every corner that you take, you see a new pharmacy. Maybe are they all of them regulated? And maybe what are you doing in regard to that? Because everywhere we have new businesses in regard to drugs, we don't know if they are registered or not.
Just to be sincere with you, Lusige, I've been to several counties for the last this 1 month. I've been to Kisii, I've been to Busia, and now I'm in Kakamega. And I can tell you that there are so many new pharmacy outlets. And my answer to you is that unfortunately most of these outlets are not regulated, either because of the 6-year capping that has been imposed on the pharmaceutical technologies, or because of the business people who look at pharmacy as a business and not as a practice. And therefore, there are a lot of mushrooming pharmacy outlets. And to me, that is a worrying trend. And my challenge is that we need to work with the government and the regulator, and the government need to employ more drug inspectors, because currently they lack the capacity to ensure that all our borders are safe.
Okay. Okay. Thank you so much, Chair. That is the Kenyan National Pharmaceutical Chairman speaking a little bit of what they have been doing across the country. They are visiting Western region to educate members of public on how to find out and to know the fake and the counterfeit drugs. And apart from that, have a session with those ones owning pharmacies and a number of medicinal people who are in charge of pharmacies and drugs across the country, to make sure that in the future we do avoid a lot of the floodings of fake drugs and also counterfeit that have affected a number of patients across the country.
Billy Lusige, thank you.